Okay, again, good afternoon to everyone. So we will continue our discussion, but first and foremost, well, let's have uh, the presentation of our learning objectives for this afternoon. Our learning objectives for this afternoon is to discuss what homeostasis is in relation to the process of pathophysiology. And later on, we'll have the topic on the discussion on the pathology. The first part of our discussion when it comes to the introduction of the pathophysiology is to give us to have an overview of what physiology is. It mentioned that it is related to the functions and processes. And in relation to that, we have discussed last time the 6 characteristics of life. And I will now open the floor before we proceed to the transition of new topics for some clarifications and questions. So you may just raise your hand or unmute or type your questions in the chat box. So later on, as we continue after the review and the review of the 6 characteristics of life, self-assessment exercise are prepared for everyone. So when it comes to the 6 characteristics of life, we have organization, metabolism, responsiveness, growth, development and differentiation, and reproduction. So we have discussed last time that when we talk about organization, this is in relation to the term relationship. Relationship by which each of the organs, each of tissues have a distinct characteristics of the cell. And eventually, for each organ and tissues, we can differentiate microscopically the the structure of the cells and characteristics of the cells as it is identified to its specific and distinct organ or system and even tissues. So class, if you will notice as it is projected again on our screen that the characteristics and the structure of cells for each organ are different from each other. And if ever the client may have the microscopic evaluation of the retrieved tissues from the specific organ and eventually revealed that the characteristic is different from its origin, then the client will be subject for the succeeding diagnostic examination for confirmatory or definitive diagnosis. So if we say organization, each of the organ, the system, the tissues has a distinct function and processes, and at the same time, reaching to the cellular and the chemical level, it identifies the specific cellular function and characteristics, rather, not function, characteristics, at is evaluated microscopically. So this is organization. When we talk about metabolism, we have defined before that it is always a consideration that the cells needs metabolic activity because merely the concept of metabolism is significant when it comes to the action of the atoms, the molecules, the proteins of the cell, so that it will help to respond accordingly if it is a compensation or an effect of external factors. Just like for the metabolism, usually it is the ability to use energy to perform vital functions. And the energy will come from the oxygen and nutrients that is transported to the various cells. And one of the typical example of metabolism that we have identified last time is the digestive process. And in the digestive process, we have identified the end product of carbohydrates as glucose, sucrose, and fructose. And we have identified also the end product of the protein as amino acids and fats as fatty acids. Why it is very important to know that these end products are very essential for the physiologic process. Simply because the cells will definitely function appropriately and to its orientation if the nutrients, oxygenation are reserved in the mitochondria. The mitochondria is the powerhouse of the cell, and eventually metabolic activities are very important. So the source of energy will probably come from calories that could be earned from the carbohydrates. And if ever there are tissues that are damaged, the repair could be facilitated by the amino acids. And if ever the end product of carbohydrates may not be sufficient to regulate the temperature and metabolic process, the fatty acids could be an alternative. So this is a very important activity of the cells and the physiologic in the physiologic process, because this is our reference for the body to respond accordingly. So next, other than metabolism, we have responsiveness. When it comes to the responsiveness, um the nurse will see to it on how the principles can be utilized to address and to apply, even implement care management to clients. Class, whenever you will experience any signs, symptoms, or manifestations, it will alarm us and alert the person or individual that it is not the normal response of the body. It could be a dysfunction, it could be a deviation. Just like, for example, when it comes to the temperature, the increase in the level of temperature or body temperature may not be normal. This could be an effect of either inflammation or an effect caused by infection, or directly a problem on the temperature regulating part of the brain, which is the hypothalamus. Now, to specifically manage the temperature, we need to have the response in the application of the principles. Just like when we use when the person has the increased level of temperature, then the heat itself may cause the possibility of evaporation, and that evaporation seemingly may have an effect on insensible losses. And that insensible losses may cause the possibility of electrolyte imbalance and may have chances that the person could be high risk for dehydration. On the other hand, since because the patient may also have hypermetabolic activity due to the heat production, increased heat production, then the person could possibly experience increased perspiration. However, when it comes to this aspect, tepid sponge bath can be managed or can be used as a care management, because of the process of conduction. And when it comes to the ventilation, the convection can be used to manage the temperature, the body temperature. In this way, these principles are used for mechanisms of heat loss, and responsiveness are basically identified on how the organism respond and adjust to the environment. So we have the number one. Let's have a review. The number one, we have organization. It shows about relationship. When we talk about metabolism, it specifies energy. And if we talk about responsiveness, the use of senses or the sense changes so that the body will prevent any harm or any damage to tissues. Now, number four, we have discussed growth. Okay, when it comes to growth, this is obviously for the increasing age. It is expected to have the increase in size. We have identified before during the time of the discussion of the systems review, we have the concern with osteoporosis and osteomalacia. When it comes to the osteoporosis, it is very important to consider the vitamin D. And if there will be problems with the vitamin D deficiency, then this may cause the possibility of decreased storage of calcium. The calcium is very important to make the bone strong and may facilitate the growth itself. Now, the one that is increasing in size, it's not merely the body of the bone. It's from the cartilage. The growth of the cartilage are the ones that facilitates the growth of the bone. So any other than the bone, the increase in the size of the internal organs are also significant, because this could be facilitated by the action of hormones of the body. Now, when it comes to the growth, it is expected from embryo to young person to adult to have the increase in the size. Next po, when it comes to the number five, we have discussed before the development that includes the changes in an organism through the time. And we have even discussed before that whenever we are talking on the perspective that a person may have or may experience disease, then there could be a different response from the age and population group. A child, an infant may have a different response from an elder. An adult may have a different response from diseases or disease process from an elder and the children. In this way, this could identify factors that why there are different responses coming from the different age and population group. It is simply because we are aware, and I even emphasized unto you before, that in the increasing age, we expect change in the physiological process or physiologic response. So level of hormones may decrease also upon increasing the age. Changes in the tissues may also are also affected in the increasing age. Second, when it comes to the immune system, it is basically different from children up to the elders. So through the development, it gives us the idea that the physiologic response is very significant upon the growth and development. So when it comes to growth, we are talking about the size. We're talking about for the development, it's on the changes that we expect physiologically to individuals as it increases the age. Now, let's now proceed to what differentiation is. So we have discussed last time that, for example, the sperm cell and the egg cell unite. Then once these two cells unite with each other, then possibility that it could lead to zygote. Now, the next is when the zygote turns into the embryo, because it only originated with two cells, how and to what extent that the other organs of the embryo will develop. And this is from the time that it started with the egg cell and the sperm cell. From the generalized, then this will be divided into the specialized cells, which means there will be cells that will be identified for the blood. There will be cells that will be identified for muscles. There will be cells that will be identified for the bone, and the cells that could be identified for nerves. So these are very essential simply because uh, when a zygote turned into the embryo and the viability is expected, then the process itself of an organism, even in weeks time, which the embryo is not fully developed and it becomes fetus, it goes with the period that the fetus will develop such system, including the organs. But this could be facilitated from the generalized to the specialized type of cell. So that's why it is distinct na, as we discuss and go back to organization, that the structure of the cells are very distinct na that we could identify when it is tested microscopically. Next po, the last of the 6 characteristics of life that we have discussed last time is reproduction. So in the reproduction po, it started from the female and the egg, then the zygote, then we have the embryo. From the embryo, it becomes a new organism. So from the cell, it becomes a new organism. If the cell started from generalized to specialized, that is differentiation. But if we talk about the cell from the female to the male sperm cell to the egg cell unite with each other and form another organism, that is related to reproduction. It is the time now as a routine, okay, as a routine that we will have our self-assessment exercises. The self-assessment exercises are necessary for us and for me as well as your facilitators, as your facilitator rather, to evaluate what you have learned from the previous topic. Again, we are 48. Okay, we are 48 in the Zoom on board. So 47. So I may expect majority of you will participate. Now, let us start. So we are 48. We are 48 in the room. Okay, 47 in the room. Then let's have, I may ask active participation of 85%. So I may expect out of the 48, 40 will raise the hand. Okay, so this is the question. The nurse attends to a pregnant client and was asked about how the embryo developed their organs. The nurse may consider the concept of development, reproduction, differentiation, or growth. We may need 40 out of the 48 students, or 47 students rather, that we have in N22. So we are now 9 participants raise their hand, 10 participants, students raise their hand. How about the others? So we have 15. So I will now start the counting. So we have 15, 14, 13, 12, 11, 10, 9, 8, 7. We need 40, 6, 5, 4, 3, 2, 1. So we expect supposedly of 85% of the class will participate, but only 28 participants actively raised their hand and took risks to answer the question. Now, since we lack numbers, I will be calling those who did not raise their hand. So, probably, may I call on Daniela Ricania. Miss Daniela? Miss Ricania? Okay. So, what is your answer?
My answer po is letter A, development.
Letter A, development. Okay. So we have mentioned a while ago that if we are considering the development, this refers to the changes that happens to individuals or to the organism through time. So that is development. So let us have another response if that will validate the correct answer. Thank you very much. So I'll be calling again another one. Another one who missed to raise the hand. May I call on Miss Eliza May Torre? Miss Torre? Miss
Yes
Eliza?
po.
Opo, what is your answer in our self-assessment exercise question?
Reproduction po.
Reproduction. Okay, thank you very much. So we will reveal what is the correct answer. Thank you so much. So you may now lower your hands. Now, the nurse, as mentioned, attends to a pregnant client and was asked about how the embryo developed their organs. The nurse might consider the concept of there could be two concepts that may come to your mind. One is when the sperm and the egg cell unite and um, how it will again have new organism. The other one is we are talking about how the zygote or the embryo will consider a generalized cells to specialized cells so that it will form the organs of the embryo to the fetus. The other one is we are talking about increase in size. And the other one is related to, as what I have mentioned, specialized to or generalized to specialized type of cell. So I will now reveal the answer. The answer is ayun. Okay. The answer is differentiation because as what I have told you, 'di ba, when an embryo or a zygote from the embryo will continuously develop the other organs of the body is through the cells that may compose a tissue to facilitate again another organ. So that's why differentiation is from generalized. We've started on the sperm and the egg cell until it will it divided to the different types of cells to have smooth muscle cells. We have striated cells and tissues. So those that will form the organs. Okay, so thank you very much for the response of our two students and for the try. So for the clarification, our answer is differentiation because the development refers to the changes over time. The reproduction is referring to a concept of in particular producing another organism, and the growth is referring to increase in size. Thank you so much. Next question. The next question is the nurse assists a client on health education. The nurse may consider concept of different physiologic responses from diseases in various population groups through the concept of. We are now 37 and probably I would have a lower percentage that I may have. Time 0.75. So I may need 35 participants. So the choices are development, reproduction, differentiation, growth. Again, the question, the nurse assists a client on health education. The nurse may consider concept of different physiologic response from diseases in various population groups through the concept of A, development, B, reproduction, C, differentiation, letter D, growth. I request 75% of the class at least may have active participation. Out of the 47, I may need 35 students to raise their hand. So most probably, I may assess or I may call those students who may probably raise the hand or did not raise their hands. So I may start the counting. 15. So we need 35. So we are now, I'm now starting the count. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. So we are now, by count, we have 28 participants who raised their hand and probably with the 70%. So meaning it's lower than 70% who have active participation in the class. So 28 participants, thank you very much for raising your hand. So probably I may decide this time to honor, ayan, to honor and acknowledge and recognize those who have raised the hand as their efforts. May I call on Miss Camille Panganiban on your answer. Miss Camille,
Development po, sir.
development. Okay. So the development. Okay. I will ask another one. Okay. But it doesn't mean that your answer is incorrect. So I may call another one to have a response if she or he will agree with your response. So we may call on those who raise the hand. May I ask for the participation of Reg Sebadera. Reg?
Growth po.
Yes po. What could be your answer? The best answer from these choices?
D po, growth.
D, growth. Okay. Thank you so much. Okay, now, try to analyze the question. The question refers to the different physiologic response from diseases from various population group. Di ba the one that I have discussed is related to age, di ba? Age that may possibly have different response from elder, from children, from adult. So, let us reveal the answer. The answer is development. So thank you for the try. So the answer is development simply because it will best explain po that as what I have mentioned, the physiologic responses or the physiologic process change over time from the age and from the physical features that the person may experience. So that's why I even mentioned to you even before as an example, a person who are prioritized to have the vaccination are the elders simply because they are the ones having a slow and delay response on immune system compared to children. So to be more specific, as what we have mentioned, that the cytokines, okay, the cytokines are higher than children to prevent inflammatory process compared to the elders who may have lower level of cytokines, which is very important for the prevention of inflammation. So, seemingly the development is the correct answer. Thank you very much for the try. So next question po. Next question is, you may lower your hands. Out of the 47 students, let us reveal or let us consider 80%. For 80%, so somehow I failed in 70%. Sige, let's have a lower 70%. So we have 47. So we may have at least 60%. So I may not be lower than 40%. So at least students may achieve 28 who are interested to answer the question. So the nurse attends to a client in fertility clinic. The indicated in the care plan about the process of conception. The nurse may consider the concept of development, reproduction, differentiation, growth. So we are now 19 and we may need 28. Yan, we may need 28 students who wish to respond actively with our question. So we are now 26. So I'll start counting. 15, 14, 13, 12, 11. Oh, now 28, 11. Now we reach 33. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Thank you to the 34 students who have raised their hand and actively participate to attempt to in answering the question as projected. So we may now call, for now, those who have raised their hands. May I ask the response of Miss Jana? Miss Jana Mesa, what is your answer?
Letter B for reproduction.
Letter B, reproduction. So thank you very much. We will reveal the answer later. Next, I may be calling another one if she or he will agree with you. May I call on Nikolai Marquez? Nikolai?
Reproduction din po answer ko.
Reproduction. Okay, so let us now check. The answer on this question is related to reproduction. Thank you. You are both correct. Very good. The nurse attends to a client in fertility clinic that indicated in the care plan about the process of conception. So what is the keyword that we identify here? The conception itself. On how the person, or on how it developed again to another organism. On how from the start that it started with the process of the union of the sperm and the egg cell until it becomes new organism. So that is conception. So as we differentiated a while ago, when it comes to differentiation, when it already formed the zygote to embryo and will start to form the organs, the tissues, the organs into system, then that is merely called as differentiation. If we talk about the physiologic process in the increasing age, that is referring to development. So good try. Next question. The nurse administers care to a client with febrile convulsion. The nurse considered applied principle of conduction and convection. The nurse may consider concept of, we have development, metabolism, organization, responsiveness. Out of the 47, I'll try to have at least 75. Okay, 75%. So we may have 75%. At least we could reach 35. Okay, 35 of the students to actively participate and attempt to answer the question. So again, the choices are development, metabolism, organization, responsiveness. Among the choices, one of which is related to the activation of energy. Okay, energy that is very significant in the functions of the cell. The other one is related to the relationship on how it identifies the cell as characterized when it comes to the structure, peculiar with the specific organs. Next, the other one is related to the sense changes or changes in the senses and how the body responds to the specific process. And the other one is related to the physiologic changes that happens over time. So we are now 26, 26. In the recent question, we have 34. So what happened to the other students? However, since we have not reached the 35 supposedly of the 75%, I may be calling those who did not raise their hand. Probably those students who did not raise their hand, I may call on Jeremiah. Jeremiah Ruiz. What is your answer? Jeremiah? Jeremiah? Okay. So I haven't heard any response. I'll be calling another one. If you have difficulty and can't have your audio, you can respond through the chat box. So I may be calling another one. Let us call Zaira. Miss Zaira, you?
Yes po.
Yes. What is your answer in the question?
Letter D po.
Letter
Responsive.
D, responsiveness. Thank you. Thank you so much. So we will be asked the other if she or he will agree with your response. Okay. So Miss Jeremiah responded the answer of responsiveness also. So I may be calling another one if they will agree with both of you. Okay. Those who did not raise the hand. So let's see. May I call on Ronel Dilia? Ronel?
Sir,
Yes, what is your answer in the question?
letter D rin po.
Letter D, responsiveness. Thank you so much. You may now lower your hand. From the principle of using the senses, the senses itself could be very useful on how to correct deviations and dysfunctions of the body. And the answer is related to responsiveness. That is correct. So responsiveness as defined is related on the senses or the change or the senses that change specific processes to either correct it in a way that it is not naturally managed and stabilized by our control center or the body system. The answer is responsiveness. So we have already completed. You may now lower your hands, please. We have already completed the self-assessment exercise related to the 6 characteristics of life. Now we are having the discussion and continuation of what about homeostasis. I know for a fact that homeostasis had been oriented and discussed to everyone at the time of even during the time of TFN. Homeostasis and equilibrium are already introduced to you. Even during the time of even with the environmental theory of Florence Nightingale, that the body will be balanced through through meeting the physiologic needs. Okay, so we have also considered also the concept of the in the fundamentals of nursing on the concept of stress. The stress are being considered as a form of disequilibrium because this may cause a different different response that the body may have as deviation or possible dysfunction if it will not be balanced accordingly. So we have mentioned this as homeostasis as homeo as the same, stasis as to stop. So this is related to a constant environment. For example, if the person had been exposed to a different environment, example, extreme heat, extreme cold, the body may not have any signs or symptoms and even manifestations that cannot adapt to that environment. So at least the body can regulate specifically temperature so that it may not lead to a problem with hypothermia or hyperthermia. On the other hand, other examples are if, for example, you're engaged into physical or strenuous physical activities, we are expecting that the cells will consume more oxygen. So what will be the response of the body as a compensation? Your body will definitely alert you to inhale more oxygen so that to compensate and achieve the normal level of oxygen saturation that could be essential for gas exchange. So when it comes to the principles or 2 points to consider when it comes to homeostasis, the term that we can consider here is auto regulation. If we say auto regulation or intrinsic regulation, this is considered as the response of the cell, automatic response of the cell. From the terms itself, automatic response of the cell, the cells will respond spontaneously without the control of the person himself. This cannot be controlled. So can you give me examples of the physiologic process of the body that cannot be controlled? Can you give an example?
Digestive po.
Okay, digestion. Okay, digestion cannot be controlled. Whenever,
Heart po, sir.
come again?
Yung sa heart po, yung pag-pump ng heart.
Okay, that is also correct. Thank you, Miss Sipin. The continuous contraction of the heart is definitely an intrinsic regulation. You cannot control it. The digestive process cannot be controlled because hydrochloric acid, even on empty stomach, are still regulated, okay, to increase or to decrease. Increase whenever there are food that is coming to the stomach, and if you have the intake of food, or on an empty stomach, the epithelial cells will regulate, decrease hydrochloric acid. Any other examples which considered as a body function or processes that cannot be controlled?
Immune response po.
Come again?
Immune system response po.
Okay, the immune system response. If, for example, even if you are awake, you are at sleep, you are most of the time, if you are awake, that's the time that you are conscious on how you will prevent yourselves anything that may cause and affect immune system. But if ever you will be at sleep, even you have been exposed to factors that may affect immune system, so the immune system will continuously act to prevent the body from any harm or damage. Any other physiologic activities of the body that cannot be controlled?
Sir, yung sa ano po, circulation po ng blood.
Very good. So if the heart, the contraction of the heart cannot be controlled, so it's related to the blood that cannot be controlled. You cannot definitely say to yourselves na, okay, I don't want to have the blood supply circulate in my brain. You cannot do that. I'm broken-hearted. I don't want to continuously have the cardiac output that goes to the coronary circulation. You cannot do that. So it's a continuous process. So eventually the cells will 24 hours, 7 days a week, will continuously engage into activities that is responsible for the circulation, for oxygen transport, for the digestive process, for hormonal production. So these are the things by which we cannot control. So that's why automatic. Just like in the situation like on the situation on the heart. We are aware of the action of the systole and diastole. During the systole, we are aware that this is the time that the heart definitely contracts to eject the blood. And during the diastole, it is the time that the pressure of the heart is decreased so that to facilitate the entry of the blood or refilling of the blood. Now, so from that mechanism, the valves will definitely open and close, open and close. The purpose of the valves are to prevent the backflow. So once it closes the valves, it will produce heart sound, S1 and S2. So those are auto-regulated activities of the heart. You cannot say we have S1, S2, S3, and S4. Once the nurse can assess heart sound with S3 and S4, then there could be a possibility that the person may have congenital problems or heart diseases. The person could have a problem with valves because closure of the valve simultaneously with right and left produces the heart sound, 1, and the closure of the aortic and the pulmonic valve will produce the heart sound, 2. If ever it will produce S3 and S4, then try to think of it that there is something wrong when it comes to the heart function. So it's not part of the normal regulation. So as what I have mentioned also, when it comes to the systole and the diastole, it may start on the relaxation of the heart. What will happen to the heart? The heart will definitely have relaxation mode. Then it will decrease the pressure, intracardiac pressure. The blood will enter to the atria going to the ventricle. Once the ventricle will be filled with the blood volume, then that's the time that the muscle will contract inward, okay, inward, so that to facilitate ejection of the blood to pulmonary and to the systemic circulation. So it's a continuous process. So that is merely talking about autoregulation. Even respiration, you cannot control. Okay, stop breathing because I don't want to live anymore. I don't want to. So those situations that may come your mind, this may not control breathing. And in such a way, the lungs will continue to expand and to relax to accommodate oxygenation and facilitate gas exchange. So let us now set an example in pathophysiology on how the autoregulation are affected. So for example, the heart, we will not get away from the heart na. Dito na tayo. So sa heart, for example, we have the muscles, which is the majority of the composition of the heart. So from the muscles, we have the the myocardium, which is obviously the muscles in the heart. So we have the myocardium, we have the myocardial cells. If the myocardial cells will intend to be more positively charged, then this will facilitate contraction of the muscle. And if the cells of the myocardium or myocardial cells becomes negative, then that's the time that the muscles will be relaxed and facilitate diastolic pressure. So on that note, when is the time that the autoregulation system or processes are affected? I just want to ask, do you please give me an example of factors that may affect the heart? Any factors, modifiable or non-modifiable risk factors that may directly affect the heart? Anyone? Students? Any risk factors that you may identify?
Sir, blockage po sa arteries.
Okay. So let us be more specific. What specific aspect or factors that will cause blocking of the blood vessels? Ayan, I think I have received an answer. So we will get there, Miss Sipin, as it identifies the blocking. Okay, we have an answer from Denise. We have cholesterol. Miss Mesa have obesity. So probably let's have cholesterol. Okay. Actually, cholesterol, once it will be synthesized, it will give us calories and reserve energy. However, too much of the cholesterol that cannot be synthesized by the body will definitely what? Will definitely combine with the plasma of the blood and will be traveling throughout the circulation inside, obviously, of the blood vessel. So let's face it, the cholesterol are insoluble, meaning it cannot be dissolved. So it will just be carried by the lipoprotein in the blood, which is what we call LDL. So if the lipoprotein will be carried in the blood and it may travel to the different parts of the body, most that could be high risk for the obstruction are the smaller blood vessels, arterioles and venules. So whenever there could be an increase in the cholesterol in the blood, that is what we call hypercholesterolemia or hyperlipidemia, it will pass through the different blood vessels. Then there could be a possibility if there is an increase in the cholesterol in the blood, once it enter the coronary circulation or the coronary arteries, there could be a possibility that the increased cholesterol or the cholesterol itself will cause dislodgement to the epithelial lining of the blood vessels. If it will cause dislodgement to the epithelial lining of the blood vessel, will it cause ba obstruction? Ayan na, papasok na tayo ni Sipin to your concept. Will it cause ba obstruction if the cholesterol will dislodge on the lining of the blood vessels?
Yes po.
Yes. So once it will cause dislodgement to the blood vessels and due to the cholesterol or fatty plaques, will it delay the flow of the blood?
Yes po.
Okay. If it will delay the flow of the blood, do you think it will decrease also oxygen supply to the myocardial cells?
Yes
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 po.
po.
If it will decrease the oxygen supply to myocardial cells, then do you think the metabolic activity of the cells will be decreased also?
Yes po.
If it will decrease the metabolic activities of the cell, do you think it may affect also the response of the cell?
Yes po.
So thus, this may lead to a possibility of decreased cellular activity, including the molecules and atoms on electrical charges. Di ba, I have oriented to you a while ago that the electrical charges of the cell are very significant on how the muscles will contract and relax. If it will cause a delay, ayan if it will cause a delay in the electrical impulse transmission of the myocardial cells, this may affect the contractility of the heart. If it will affect the contractility of the heart, it may not balance systole and diastole. That's why there are some situations that the systole is very high, the diastole is on a normal level. But on that perspective, when the systole is higher, as expected, kasi systole siya, kasi high pressure talaga ang systole, then it could be higher than the normal level. This is an indication that there's already a starting intracardiac pressure. So if there is increase in the pressure, which is the blood pressure, then that may lead to the hypertension. So probably this situation may affect the autoregulation because automatically the cells must have the complete transmission of impulse of when is the time, the proper pacing. Diba? The proper pacing of the systole and diastole. So with the S1 and S2, lub-dub, lub-dub, lub-dub. So there could be a possibility of lub, dub, lub, dub, instead of lub-dub, lub-dub, lub-dub. So those supposedly, the lub-dub that we are aware is the autoregulation. But once we identify already a risk factor that which may lead to a disease, this may cause the possibility of affecting the lub-dub because it may affect the opening and the closing of the valves. So, and basically, it may affect also the contractility of the heart since we have mentioned about electrical charges, and that is based or that is related to the conductivity of the heart. So on that note, we have identified autoregulation. Another, let us identify within the function of the intestines. Okay, sa intestines tayo ha. Do intestines has muscle? Do intestines has muscle? May muscle bang intestine? Students. Do intestines, do our intestines has muscles?
Meron po, sir.
Yes, because the muscles are very important for the intestines to contract. Okay, to contract so that to facilitate excretion, di ba? Excretion of the waste products. If there will be no muscles, then definitely how the bowel will pass out from the intestines. So the autoregulation that happens through the intestines is whenever there will be any content from the digestion, the products of digestion will definitely absorb via the intestine. Some of the nutrients of the food that undergone the digestive process will be absorbed. by the body. Some that are not useful will definitely be excreted by the body. So, what will be the autoregulation that may happen? The intestine will facilitate the storage of those waste product until time that it may lead to urge, okay, to urge, so that to facilitate, kasi di ba pag the intestines will be full, the nerves will transmit impulse so that to facilitate the intestinal muscle or motility to increase, to promote bowel or removal of the contents of the intestine. Now, in those situations, let us have an example. That is the normal process. It's auto-regulated. The intestine are geared towards that process. So it will increase motility so that to facilitate the excretion of the waste products or content of the intestines. Can you give me example by which may affect the functions of intestine? Anyone? Can you give an example or factors that may affect intestinal motility? Anyone from the group? I'm not hearing anyone. To silence means yes, or silence means that I need to respond na. But I will still wait. So I have responses from the chat box. Okay, constipation could be. So when it comes to the constipation, kasi the constipation is already the it's already the, what do you call this? It's already a symptom. Okay, a symptom that the person may verbalize. Kasi let us consider why it led to constipation. So higher level yung cause. So I have, okay, hemorrhoids, we have GERD, we have Crohn's. Okay. So, okay, ganito po. Hemorrhoids could be. Sige, tignan natin what happens with this situation. Usually what happens with hemorrhoids? Usually the problem with hemorrhoids is we have the loss of the intestinal muscle. Okay? That is forced, actually forced by the pressure created in the intestinal area. The other consideration diyan po is on the lower rectum. The lower rectum, yung blood vessels are swollen. Just similar as with the have you seen varicose veins? Di ba pag varicose veins, the problem with the varicose veins are blood vessels are protruded on the lower extremities. That is also what happened with individuals who have hemorrhoids. Okay, now this is now the problem. Since we have swollen veins in the anus, and varicosity is the medical term with that, then this may cause the possibility that the varicose veins may not facilitate the continuous circulation. Okay, the veins are the ones obviously carrying the non-oxygenated blood. If there will be decreased circulation of the non-oxygenated blood, there will be also a decrease in the supply of oxygenated blood because it is a continuous process. However, even though the heart can facilitate the supply of enough circulation, but the pressure created in the veins of the intestines may cause harm. So to what extent? Because if it will cause the varicosity on the anal area, specifically on the lower rectal area or anal area, the varicosity itself may cause the obstruction. The one, because protruded, swollen yung blood vessels or specifically the vein. So once supposedly the stool will pass out, these varicosities in the anus will block. Okay, once it will be blocked, and you will force to strain. Okay, to strain. that may cause the irritation of the tissues, and eventually, since blood vessels are swollen, there could be a damage due to the inflammation. Kasi imagine niyo, when the stool passes through the anal sphincter, and there's varicosity that blocks the passageway, it may cause irritation and possibly may cause bleeding, because the blood vessels which are swollen may cause that problem with tissue damage and possibly may lead to bleeding. That's why for those who may have hemorrhoids, after the passage of stool, there's a drop of blood, bright red blood, because that's a proof or an evidence that the bleeding happens on the anal, that not in the internal or higher upper intestinal tract. It's more on the lower intestinal tract, and specifically in the anal or the rectal area, which is the lower part. So in this situation, how the situation goes, that the hemorrhoids contributed to the problem of the supposedly normal excretion of the bowel or stool. Because of the varicosities that creates obstruction, it may cause the obstruction itself may cause the retention of the supposed stool that will pass out. So what will happen? Pwede bang mag-cause 'yon ng impaction, yung mismong stool in the intestines, and it will overstretch the intestinal muscle. Even though the intestinal muscle will contract, it may not be sufficient because of the constipation. So that's the time that the constipation itself happens because of the problem with the hemorrhoids. So on that note, it may affect the autoregulation process. So that is the problem with hemorrhoids. So I hope you are learning now. You need to take into consideration what you have learned on the normal physiology and the function of each parts and the system. Then you will compare to a situation that we have already identified a disease process or a disorder, which we mentioned hemorrhoids. So as we define the hemorrhoids, what happens? There is varicosity, there is veins, swollen veins in the anal or lower anus. So that varicosity may cause the obstruction, and that made the person constipated. So, and may affect specifically the normal mechanism of supposedly the intestinal muscles will contract to excrete the stool and facilitate bowel. So next po is all about extrinsic regulation. If we talk about extrinsic regulation, this is specifically a response that is brought about by a stimulus. If we say a stimulus, factors that may cause the response. Okay? So results from activity of nervous system and endocrine system. Example, during the menstruation, okay, let's proceed with the endocrine ha. During menstruation, do the hormonal level increase or decrease? Do hormonal level is increase or decrease during menstruation? Ha?
Increase.
Increase or decrease? Louder po. Miss Tanghal?
Increase po.
Increase. Okay. Now, the increase in the hormones or the female hormones may facilitate the menstruation or the menstrual flow simply because increase in the hormonal regulation facilitates the what we call increased metabolic activity. If it will increase metabolic activity, this will facilitate increased cellular response. If it will increase cellular response, then the possibility that may lead to the menstrual activity, because the system itself, the reproductive system itself of the female will increase its activity and will produce such that is supposedly be removed out of the body of the female. So in this situation, the hormones is directly associated or related when it comes to the activity and leads to menstruation. So that's a normal. Yeah, that's a normal a normal process. Increased hormonal level to females leads to the chances of the menstrual cycle or process. Now, when is the time When is the time that there are situations that there is irregular menstruation. Okay, the irregular menstruation is related to, obviously, if we are talking about the hormones, then there could be a possibility that if there's irregular menstruation, there could be a possibility of irregular hormonal secretion. So on that note, the normal response that we are aware that the hormones respond to facilitate the menstruation. Now, if there are irregular menstruation, there's something wrong, obviously, that could be associated with the level of hormones. So other than that, there are also what's reproductive organ which will facilitate, female reproductive organ which will facilitate the process of the menstruation. This could be involved ba ang ovaries, involved ba ang fallopian tube? The answer is definitely yes. In such a way that the hormonal activity specifically follow through the menstrual cycle. If hormones are affected, then the possibility that menstruation will be cessated or will be disrupted. So that is just a typical example. Another example po of extrinsic regulation, kasi ito naman ay brought about by something that is merely mayroong cause. Unlike for the auto-regulation, it's automatic, a continuous process. Kasi let's face it, ang menstruation hindi naman throughout your life you have menstruation, and it passes, and it will be lead to cessation whenever an individual reaches an old age, because that's the time that the hormones are already decreasing in level. So extrinsic regulation, hindi may siya continuous, unlike for the time of infancy going to the late adulthood. Respiration is a continuous process. Heart contraction is a continuous process. Circulation of blood is a continuous process. That is autoregulation. So ang extrinsic regulation could be brought about by the level or function or processes of the endocrine system. Another, adrenaline. Okay? Adrenaline is a hormone that is released by the adrenal glands of the kidneys. And it's not always, or it's not at all times, that the adrenal glands release adrenaline, because in some situation adrenaline are released in a process that the body may need. So eventually, for example, if the patient may have a problem with hypertension, then the kidney will release, specifically by the adrenal glands, will release adrenaline. So situations that may need, the stimulation of the body to help the other organs. So may factors to consider. So since the problem is hypertension, so the kidney will release the adrenaline, then it will continue to help regulate the blood pressure until it will be stabilized. But for situations that we have normal blood pressure naman, the kidney or the adrenal glands will not be necessary to release adrenaline. So yan yung extrinsic regulation. Okay? Any questions so far? Okay, so calling once, twice, thrice, hearing none. So I will continue. Next po. Now, let us now proceed on the concept of receptor, control center, and effector. I know this has been also introduced in the anatomy and physiology. So, a typical example of reception. Pag reception, stimulus, control center, usually yan, the brain or the nervous system, and effector is what is the effect on the response of the control center. That's why the control center, should we say, is the command center. The central nervous system. Kaya nga siya central, the brain is the one that controls majority of our physiologic processes. So that's why when we talk about the receptor, it is usually associated with the stimulus, and the effector is the response coming from the response that happens. Okay, the response that happens from the control center. So let's have a typical example. So for example, we have the stimulus, we have the receptor that receives, for example, a problem with deviation, alarming. What are those that could be alarming to the homeostasis? So for example, for a person who are having history of asthma, so exposed to allergens, So ano yung exposed to allergens? Somehow yung mga defense ng sneezing. Okay, the sneezing as well is a sign wherein the person is exposed already to allergens. So what will happen? What will happen? The control center will regulate, since this is related to the respiratory system, the medulla oblongata will regulate the sufficient oxygenation to the person, kasi eventually we are aware that when the person experiences exposure to allergens, there is a sudden response on the constriction of the airway passages. So what will be the response of the control center? The response of the control center is to open the airway, even the person is exposed to allergens. So what is the effector? So ang effector noon is the medulla oblongata will still facilitate the gas exchange and will relax the smooth muscle so that to facilitate the entry of the oxygen and removal of the carbon dioxide until the person may not experience asthma attack. But on the other hand, if the control center may not manage it, that's the time that the problem with the pathologic response comes in. So this may happen na that the control center may not have the sufficient response, and that's why if the person leads to difficulty of breathing, which is supposedly preventive, that's the time that the control center did not manage it because of the other factors. Probably the person who has the asthma, has the allergens, exposure to allergens that greatly affect the sudden constriction of the airway passages, and the control center may not be very timely to respond to that situation. So what happens? The asthma attack comes in and possibly leads to a complication of status asthmaticus. So pag nag-lead na yan sa status asthmaticus wherein constriction of the airway passages, ayun, there's a problem na magsa-circulate na naman ulit sa cycle tayo ng homeostatic from the receptor, control center, and effector kung the body can still respond to compensate. If the body will not continuously respond, ibig sabihin, we are not attaining the homeostatic regulation. Ibig sabihin, the body is having a deviation with the normal functioning, so there must be there's a need to have immediate medical attention. So let's have a typical example. Let us now associate this with the normal response of the body. Sa normal response of the body po natin, for example, is when a person is exposed to what you call this? When a person is exposed to extreme heat. Okay. So obviously, the body will absorb the heat. Okay? And you can feel that whenever you're exposed to extreme heat. And those heat that will transfer to your body via the convection principle, di ba? Convection principle, environmental. So your body will feel na there's an increase in the temperature. Okay? Increase in the temperature, and you will feel that. You will feel that because of the dermatomes that are present in our body. Then what will be the action? In the start of the rising of the body temperature, the one that will consider the receptor will transmit impulse to the brain. Once the information will be transmitted to the brain, the one that is responsible for thermoregulation is the hypothalamus. So what will be the action of the hypothalamus? The hypothalamus as a command center will command the responsible organs, the system that can help in the stabilization of the temperature. So si hypothalamus as a control center, it extended its signal and sends command to the sweat glands of the skin and the blood vessels. So what happens now is the sweat glands in the skin, in the integumentary system, will increase its activity so that to facilitate the secretion and the release of the perspiration. So yung perspiration itself is the one that can definitely be helpful to balance body temperature. So the blood vessels will definitely dilate in the skin, and it may have an effect in the sweat glands to facilitate the metabolic activity of managing the temperature by the sweating. And once the person will sweat, the temperature will be lowered down and go back to its normal body temperature. So that is the one that I'm talking about when it comes to this mechanism. So when we talk about another homeostasis, how about, sir, what are those situations? For example, let us now relate with the pathophysiology. For example, head injury. Okay. With the head injury, there could be a trauma. Okay, head trauma. For the head trauma, there could be two aspects that we may consider. Possibly the person may have bleeding, or the person may have the inflamed tissues. The two factors that I have considered may alter the function of the brain kasi it may lead to pag-inflammation, there could be the tissues could be thickened and may compress the brain. Kung bleeding naman, there could be a possibility that it will proceed to spaces in the brain at pwede ring mag-cause ng compression. So with that, it may increase intracranial pressure. So that's the start. So how the homeostatic regulation will be possibly at risk to disequilibrium. So for example, head injury. So the head injury comes in as there is basically a trauma. So the trauma that may be created, for example, is inflammation. So if there is inflammation or trauma or damage to tissues, what will be the receptor? The receptor that could facilitate is directly on the, for example, blood vessels. Okay, because the inflammation could be prevented. Further inflammation could be prevented if the circulation will be continuously supplied to the affected tissues. However, since the supposedly control center is the one being affected, that is now the problem. The problem is that of it's supposedly the information that will be coming from the circulatory system, specifically the blood vessels, must transmit the information to the control center, which is the brain. So even though in the receptors, the circulatory system of the blood vessel will transmit signal to the brain, but the brain itself is the one that are being damaged or problem. So it may possibly cause the concern within the brain because it may not possibly transmit command to the specific organs that may help the brain to prevent complication, because we all know pag ang control center ng affected, it may cause the possibility of the break in the impulse transmission. So hindi na siya magpupunta sa effector kasi nga the brain itself is the one that are being affected. So that's why on that situation, it may stop to the function of the control center. It may not respond to equilibrium because it was blocked already sa brain natin when it comes to that effect. So what is the problem now? The effect is that of if the brain cannot command the blood vessels to have the continuous blood supply, so the problem naman na dyan is it will cause the decreased blood supply to the brain and will continuously increase the inflammatory process. So nag-stop na doon. So hindi na siya magre-reach sa homeostasis. Magkaroon na siya ng disruption, disequilibrium na po ang tawag doon. So on that situation na po, there is something wrong with that. So it's not anymore homeostasis, it's already disequilibrium. So hoping you can relate to those concepts of the homeostasis. Now we will proceed to pathology. Okay, so probably at 6 o'clock we may have a break na rather than 6:30. So, but let us first start with this pathology. Okay. When it comes to the pathology, sir, we have identified physiology. Okay. Sa physiology, we have mentioned it's the function, the processes. But when it comes to the pathology, always take into consideration that it is already associated with disease. Diseases that may affect function of the chemical level, the cells, tissues, organ system until the organism is already affected. So that's why usually when we talk about the pathology, it will give us the idea of identifying the cause and effect. And usually this causes may merely consider po of the changes that may happen to the normal functioning of cells and tissues. So a typical cause can be retrieved through the data and information coming from the patient history. May past medical history, present medical history or present history of illness. So the nurse can do that, and it's our role to identify so that it will give us the direction of suspecting a possible problem of disequilibrium to the patient and how we will prevent complications. So if we can only if we are just only focus on the effects, then the possible concern that, for example, sir, how about if the patient is unconscious? How he or she can respond to my questions to ask for the causes? Tapos no one is accompanying him or her. So the next thing to do is you will manage to check the signs. Okay, so you start with the vital signs, and if ever there are deviations in the vital signs, then that will give you directions on what could be the immediate action that you will do and what diagnostic exams will be prioritized with that situation. Because eventually, if we are aware of the normal supposedly physical examination findings, and if it is already deviated, consider the patient as having a problem with this aspect of either a disease or an injury. And that comes in yung tinatawag nating pathology. So when it comes to pathology, again, aside from the disease process, it may focus on the physical changes in disease organs and tissues. So that's why in anatomy and physiology, it is very important for us to know kung ano po yung normal structure, yung size, normal structure, size, if it is inflamed. For example, diagnostic examinations can give us the idea. For example, for X-ray, this may give us idea if there is fracture or break in the bone. We can identify through X-ray if there is an enlargement of the size of the heart. Through the X-ray, it can identify if there is presence of fluid in the lungs. So those are the ways which we could identify if there are possible physical changes, even though we may not see the lungs internally, but the diagnostic examinations may give us a hint, a clue, or somehow with the size itself. That's why most pagka mga ultrasound, X-ray, there's a specific size of it that are specified in the results, because this may identify specifically if the person is still in the normal size of the specific organ. So just like in the photo that you are now witnessing, we have the lungs. Okay, these are the lungs po. These are definitely the lungs that basically describe those who are having smoking. Okay, from the normal lungs that are supposedly expected to be pinkish and light brown or pinkish, which is significant po yan na with proper circulation. Then we have also the pleura that definitely protects the lungs. This is now the situation of a person who's having the smoking. Not just only smoking. What we are not just only talking of the primary smoke. We may also take into consideration the secondary smoke. For primary smoker, you may develop emphysema. The emphysema may affect the alveoli. But for the secondary smoke, you may possibly experience bronchitis. So bronchitis is the inflammation of the bronchi. So either ways, you have the first-hand smoke, the second-hand smoke, it will still have a problem with the lungs, and thus this the component of the cigarette smoke, which is nicotine, could be harmful because once it inhaled by the body and will proceed to the different respiratory structures, this may cause the damage of tissues. This may facilitate the possibility of damage to alveoli, which is the basic unit of the respiratory system. And thus, this may cause the possibility of gas exchange or alteration in the gas exchange, which may affect the circulation already. So, and thus, since the circulation will be affected, the lungs, the circulation or the pulmonary circulation will definitely be affected. So that's why continue smoking. Oh, let us learn about it. Learn to have cessation in smoking. Don't even engage yourselves in smoking. Okay? So the physical changes itself, that's why when the person undergone an operation and there will be removal, there will be examination of the organs, the doctors and the nurses can identify if it is not, even though if it is not yet subject for biopsy, this will cause eventually even the visual evaluation may merely or suspect these changes as abnormality. Thus, the nurse and the doctor may subject the client's tissue to a further examination. So, disease organs or tissues. So expect if ever the client, for example, has jaundice, what specific organ would possibly be affected if there is jaundice or yellowish discoloration of the skin?
Liver po.
Liver, very good. How about if the skin is bronze in color? Bronze in color. Bronze-like yung skin color niya. Almost ano na siya, almost dark brown tapos parang bronze-like color na. Usually those may cause the possibility that the patient may have kidney problems. Yon. So even though we may not see the actual organ itself, but the signs that we observe may already direct us on the possible diagnostic examination that the patient may have. So since it's already 6 o'clock and we may have an early health break, which is supposedly at 6:30 to 6:45. So we may have the 15 minutes break. So for 15 minutes, try to refresh yourselves and have hydration before we continue at 6:15. Thank you very much. We'll be back. So again, N22 will resume our synchronous session. So actually we had extended 5 minutes for 20 minutes health break. Okay. Now, as what I have mentioned, we have the pathology as it is related to the disease process in relation to its effect to the cells, to the tissues, the organ system, and the organism as a whole. Now, to continue, we have the what we call surgical pathology. Actually, surgical pathology is a branch of pathology which the focus is mainly on examining tissues. We're familiar definitely with tissue biopsy, and that is only one way of which it could have a definitive diagnosis. If we say a definitive diagnosis, this will concern the confirmatory diagnosis of the client. When it comes to the surgical pathology, the pathology itself is the disease which may significantly affect the cells, the tissues, the organs, the organ system, and again, as mentioned, the organism as a whole. Now, even during the surgeries that an individual may have, the tissues that will be retrieved from the procedure may be subject for the microscopic examination. If we go back to the concepts of the 6 characteristics of life, organization, di ba? It identifies and specifies relationship. And the cells are characterized distinctively with each organ. So that's why we can distinguish cells from the muscle, cells from other tissues, epithelial, cells on the endothelial. So this may have, if it is evaluated microscopically, will have the distinct characteristics and structure. If this may cause the possibility of a major difference to the original structure and characteristics, then the client will be subject to other tests that will have confirmatory. So initially, for a surgical pathology, this may identify, what do you call this? This may subject the client, will be advised by the client, will advise by the doctor rather, to have the client undergone surgery to facilitate retrieval of tissues for examination. So that is surgical pathology. So as an example, I have been assigned in the operating room, and many times that I have sent specimens for the microscopic analysis. And these surgical procedures are done if the physicians are suspecting for any presence of tissues that is basically and possibly may be considered as benign or malignant. Benign, big sabihin, non-cancerous, and malignant as cancerous. But this could not be done with just by our naked eye. This could be done microscopically by the evaluation of tissues. And that is surgical pathology. Now, an example dito, an example dito is myoma. Myoma are presence of cysts in the uterine cavity. And usually, pag a person may have multiple myoma or cysts in the uterus, the obstetrician or the surgeon may suggest eventually removal of the uterus, because if the multiple myoma is present, even though it's benign, the myoma or the cyst itself may impede circulation of the uterus, and possibly that pressure that may be created or that may cause with that may be present and dislodge in the uterine cavity may lead to the possibility of obstruction of circulation and may increase intravascular pressure. So that could be possibly the cause pa of bleeding. And the bleeding may lead to a problem with hypovolemic shock of too much and profuse bleeding that cannot be controllable. That's why any profuse bleeding that a female individual may have, this is very distinct that there could be a blood vessels involved. There could be a possibility of a ruptured cyst. And these fluids can be also be subject for a test so that to have a distinct findings if it is an infection or coming from a ruptured organ. So just the same, for example, with ovarian cyst. For the ovarian cyst, since it is related to the hormonal regulation, if a person may experience bleeding, the ovary and the reproductive structures are being evaluated. And thus, if this continuously have bleeding, then it will check surgically if there could be a possibility of removal of the ovaries, of the fallopian tube, that certainly considered as the cause of bleeding. So then it will not end there. It will subject the tissues for microscopic analysis if the ruptured cyst is caused by the damage of tissues, which could be benign or malignant. So those are the situations by which pagka ovarian cyst ang ruptured, hindi bright red ang color ng blood. It's almost chocolate brown yung color. So that will give us the idea if it's a ruptured ovarian cyst. And that anything that is either a ruptured ovarian cyst, a ruptured blood vessels in the uterine cavity caused by the myoma or cyst or uterine cyst, this eventually may lead to the decreased blood volume because of too much hemorrhage or bleeding. So these are the things that we need to take into consideration. The surgical pathology is used for examining tissues. Next po, we have cytopathology. Okay, for cytopathology, tissues will be evaluated for surgical pathology. But once we will go deeper on the evaluation of tissues and fluids for the cellular level, if it has infection, if there is a damage if there's a damage caused by bleeding. So cytopath, pag nadidinig nyo yung cytopath, please send it for cytopath. It means that cyto means cell, pathology is the study of diseases that may have an effect to what I have mentioned, specifically with the cells. So that's why this is the study of certain diseases that may give us the direction of a clear results of affecting the cells. So that's why, for example, tissue biopsy is the procedure. If it is for cytopath, then for example, appendix, it has a ruptured yung appendix, the fluids will be also tested for cytopathology. The tissues will be also sent for cytopathology. So this will give us the idea of chances of a more deeper results if it is really a chance of the cells present in the ruptured or damaged organs are subject for further studies if it is directed possibly on evaluation of benign and malignancy. So another situation for the cytopathology, lumbar puncturing. Lumbar puncturing is a procedure by which it will aspirate spinal fluid. So probably the doctor will say, oh, please send it for cytopathology, cytopath. So meaning the fluid will be evaluated accordingly of the cells, if it's normal cells, And the cytopathology also will give results kung merong RBC, and that is a sign of bleeding. If there is a presence of WBC, which is a sign of infection. Now, on the other hand, the fluid can be subject for culture and sensitivity tests, simply to identify if there are possible presence of infection. The culture and sensitivity test may give us a direction on what specific drugs could be appropriate for the findings based from the cytopath. So that's why this will give us also a definitive diagnosis pero on the cellular level. But how about molecular pathology? So we are getting deeper from the 6 structural and functional organization. Diba, from the surgical pathology, we started with tissue. Okay? Pag sa cytopathology, it's the study of cell. Pag molecular pathology, this is definitive diagnosis that is based from the examination of organs, tissues, and bodily fluids, specifically on the molecular or chemical level. Di ba, on the chemical level, we have the molecules and the atoms. That is merely and specifically a deeper definitive results may reveal pag the patient undergone surgical pathology, cytopathology, if the doctors or the healthcare team are still in doubt, then proceed to the molecular pathology. That will give more definitive results of the disease process. So these are the aspects related to the pathology. Now, let us proceed what pathophysiology is. Since we have been oriented of what is physiology as a function or functions or processes, and we are aware that pathology is referring to the connection of disease process to the effect of the effect to the organs and tissues. So if it is combined, we have defined also pathology as the cause and effect affecting tissues and the cells. It is a combination of how the normal physiologic process will be affected by the disease process. So that's why it is called as pathophysiology. If ever, at the end of this course, if I will be assigning to you individually diseases, and if you are confident to identify risk factors based from the case, and until you are aware and confident on how it will lead to death, that is the mechanism of pathophysiology. Because if you're aware of the normal physiologic process, you can connect it with deviations and will align it based from the results of diagnostic exams, based from the patient history, and based from other findings that may support the pathway of how the patient led to this definitive diagnosis. In this situation, we will have an example related to it. Example of which is stress. Very common problem that any person may experience, pero it may have multiple effects sa physiologic process of the body. So we have been oriented that even in the pharmacology, when it comes to sympathetic and parasympathetic response, stress is more on the sympathetic response. So if we're talking about the sympathetic response, what is the effect to the heart? The effect of the heart of the sympathetic response increases the heart rate. What is the effect to the adrenal glands? Increases release of the adrenaline. Next, digestive activity, decrease digestive activity. Okay, for the sympathetic response. What happens to the bronchi? The bronchi may have bronchodilation. So, those aspects can be connected to the situation and the pathophysiology that we will discuss now, that is effect on the stress. We focus on this topic of effect of stress to the intestinal motility, on how it leaded stress to intestinal motility. What you have seen in the illustration are the effects of the stress in the body. And we will connect it on how it may lead to altered motility of the intestine. So class, let's start. The stress may cause the possibility of altered gastrointestinal microbiome. If we say gastrointestinal microbiome, there are presence of healthy microorganisms in the body, just like the lactobacilli. Stress can definitely cause the alteration of functions of gastrointestinal microbiome. This microbiome has this role when it comes to the immune system. Moreover, if there will be altered in the gastrointestinal microbiome or healthy microorganisms or microorganisms that is very important for the balance of our body functioning, there could be a possibility of chances of transient infection. So that will proceed to that. Yung transient infection na ito, from the term itself, transient, it means sudden, immediate. So how we will connect it? From the stress, it altered the gastrointestinal microbiome. So the lactobacilli and the microbiome will not function eventually to prevent the infection. So that's why the person could be high risk of the infection. And thus, the infection itself may lead to the altered endocrine metabolism. Serotonin, okay, serotonin are very important when it comes to the intestinal motility because these are neurotransmitters. Once serotonin po will be altered, it may decrease intestinal motility. Can we connect down the first three aspects of the effects of stress? The first, it may possibly start with gastrointestinal microbiome affecting the microbiome. It may cause possible infection. It may cause effect on the serotonin production responsible for the intestinal motility. Next, we may have neuronal plasticity. If we say neuronal plasticity from the term itself, neuro, this may significantly related to nerve. In this situation po, the neuronal plasticity is related to the what we call elasticity of the intestines. And thus, if there will be nerve that will be affected by the stress, it will not facilitate impulse transmission if the intestine will decrease motility or will increase motility. We must be aware of when is the time appropriate that the intestine will be urged to increase motility. Diba sometimes you will feel that you may have the bowel, but it is not in the proper timing that you must experience the bowel movement. So those are the situations that may cause its imbalances. Another, there could be a possibility of genetic polymorphism. If we say genetic polymorphisms, this may alter tissues. Next, increase mucosal permeability, meaning the mucosa is very important for the intestine to facilitate the movement, yung bowel movement. So ang nangyayari po dyan, pag nag-i-increase po ang mucosal permeability, it slows down the movement. Now the next po is we have bile acid malabsorption. Bile acid is very important for the synthesis of the too much fats in the as a product of the breakdown of the food. So pag nagkakaroon yan ng bile acid malabsorption, there could be a possibility that the content or the products of digestive process may lead to the possibility of fecal impaction, and that fecal impaction may lead to the possible constipation. So next po, it may alter mucosal immune function. So if we say altered mucosal immune function, ito yung tinatawag nating food hypersensitivity, na every time that you will eat, it will cause the possibility of either abdominal distension, or in colloquial, kabag, or possibly there could be food hypersensitivity if you may have hypogastric or epigastric or hypogastric intestinal pain, because the food may not facilitate the appropriate digestive process. So that may irritate possibly the intestinal mucosa. So can you imagine that these are the effect of stress only in your intestine? So with this effect of the problem with stress, which is already a disequilibrium, these are the effects already of the stress, which is what we call the cause. And these are the effects. And with these effects, it may lead to altered motility of intestine. So these are the information behind that why you have altered intestinal motility, somehow constipation or diarrhea when you experience stress. And these are the explanation. So that's why pag in-explain nyo, nurse, why I am experiencing constipation whenever I experience stress. So either constipation or diarrhea. Number one po, ma'am, kasi when you are on stress, the microorganism responsible for the prevention of infection may be altered po. They will not function as expected. So the next thing po is possibly you will be high risk for infection. Then other than that po, if the immune system will be a concern po, may chances po na yung serotonin po na neurotransmitter ay responsible po that will contract intestinal po muscles para po eventually to have bowel movement and facilitate the defecation or removal of stool. This may affect also, ma'am, yung stretching of the intestinal muscles then, because eventually if this may cause the decreased increased contraction po, the supposedly waste products of the intestine may not be excreted eventually. Another po, ma'am, meron po tayo, we have the called yung intestine po natin, meron po yang mucosal mucosa. Yung mucosa po, yung intestinal mucosa po is the one responsible for the bowel movement. Pag nag-increase po yung mucosal permeability, it may not facilitate po appropriate movement of bowel. Another po, if you eat too much fats, di ba yan? Yung fats is insoluble, pwedeng hindi ma-synthesize in the stomach. That may be carried throughout the intestinal. So sa intestinal, if it identifies po na mataas po yung fat content ng kinain po ninyo, then the liver will be responsible for the secretion of the bile para po ma-synthesize po yung cholesterol or increased fat content. But if it will cause a problem po with the bile, yun po ang mangyayari po dyan is it will cause the possibility that the bile may have the malabsorption and it will not facilitate the consistency of the stool. And the next po, since we have mentioned po yung immune system ay altered din po, somehow you will be sensitive with any food intake na may cause the possibility of immediate or possible constipation. So can you imagine this one that you can explain right away through the knowledge of the cause of stress in intestinal motility? Any question? Any question? If you don't have question, can you put one in the chat box if you don't have any question before I proceed with another example? Okay. So it means that you understand the concept itself of pathophysiology. Okay, majority of you are putting one, so it means it's clear. The topic is clear. And eventually from the stress itself, one of the effect only is altered motility. Stress also can affect the heart. Stress also can affect respiration. So that's another pathway. So soon, if we will have a pathophysiology and if we will have stress as the risk factor, it may have multiple effect to the different organs of the body. So next po, next as a typical example, as I mentioned po, pathophysiology is the study of the function and physiologic changes. Yung functional and physiologic changes po that is brought about or result of the disease process. Now, when it comes to this, I will show to you po the difference between a normal airway passage to a person who is experiencing asthma. Now, bronchospasm, the spasm is pag spasm it cause constriction. So usually, if you will see in the illustration, this is the normal airway, this is the asthmatic airway, and this is the airway during asthmatic attack. Okay? So that's why for those who may have asthma, why normal individuals when exposed to pollutants or airway irritations, they're not experiencing difficulty of breathing because there's sufficient space within the airway passages that can still pass oxygen and removal of carbon dioxide. While for those individuals who have already asthma, there's already thickening of the mucosa of the airway passages. While this will be more constricted if ever the person will be exposed to allergens or to pollutants or of any cause, hypersensitivity reaction from drugs, from food, it will immediately cause a tightened smooth muscles and it will trap, air will be trapped in the alveoli. That's why the response of persons who may have asthma is very sudden. And even asthmatic attack can lead to immediate death because of the constriction of the airway passages, specifically the bronchi. Although, for a normal individual po, when we are exposed to any environmental hazards such as pollutants, a normal individual can still manage to eventually prevent damage to the airway passages and may not constrict eventually. But for those who may have asthma, anything that may trigger the inflammatory process, and that is histamine 1. Histamine 1 is one that is being triggered, and this may cause the constriction and inflammatory process of the airway passages. So that's why when it is inflamed, it becomes thickened. And if it becomes thickened, there will be retention of the carbon dioxide, and there will be a problem with the oxygen intake. So with this pathophysiology, we can now differentiate from the normal respiration and from the person who may have asthma, that is already the pathology, on what is the effect in the normal process of ventilation and respiration. Okay. So I will now proceed to the next topic. The next topic or transition of the topic is related to the disease process. When it comes to the periods of diseases, it will give us the idea. Okay, we will now proceed to the periods of disease and its process. Now we have been oriented on the the pathophysiology. Basic concepts of pathophysiology, review of systems, 6 characteristics and functional organization. So these are very basic knowledge. That's why I have introduced you and we have a review first of these concepts before we proceed with the periods of disease. Class, we have defined disease as a deviation of normal state of health or from a state of wellness. When we define the health, it's the state of balance, which is correct. It is the state wherein the person is in homeostasis. It's in equilibrium. But whenever there is a disease, it's already, the term already that can be associated is deviation, dysfunction, abnormalities. So these are the terms that can be associated because it's not, it did not already sustain the balance. And thus, to give you po an idea of what disease process is, we have the what we call, for example, the red graph The red graph represents pathogens. Okay, pathogens. If we say pathogens, these are the causative agents. Either viruses, fungi, bacteria. So these are the pathogens. Now, when the person is exposed to pathogens, the blue lines with this bell curve represents the what we call severity. Means this represents the symptoms. Now, in this situation po, when the person on the incubation period, that's why, di ba, you have been oriented pagka may what you call this, when the times that you have been exposed to a person with positive and confirmed COVID-19, before we are oriented that the incubation period that the person must be observed is 14 days, right? So it means kasi during the incubation period, from the time that you have been exposed to the person with a positive viral infection, that is the time within the 14 days that you need to be observed and isolated, because those are the chances that even though you are asymptomatic, but you're carrying already the virus. So either within the 14 days, it's not on the first day that you have been exposed, but on the succeeding days that it will appear the signs of the infection. So when we talk about the incubation, that is when the start you have been exposed to pathogens or causative agent until with the prodromal. If we say the prodromal, the manifestations already appeared. Okay? When it comes to the period of illness, yan. Pag the period of illness na, this is the peak wherein it already identified that the virus is already affecting your physiologic process. Kaya even in the prodromal period, you may have hyperthermia only or problem with the febrile conditions. But as it goes on with the period, with the succeeding days, it adds the symptoms that you are experiencing, and that is the peak of the more symptoms and signs that it will reveal, the chances that the disease is progressing. Okay, progressing ibig sabihin nag-i-increase yung nagli-lead to the increase yung severity of disease. Kung halimbawa po that within the incubation period that na-expose ka, yung onset, yung start na you have been exposed to that person, tapos you manifested one of the symptoms or signs that you are aware of, pwedeng prodromal yan. Pero pagdating sa period of illness, once it added and it appear majority of the signs and symptoms that you have been oriented, then that is the period of illness. So that's why it increases the severity. Now, in this period, once it reaches the top, it means that this is the peak of severity and peak that the pathogens are increased. So ibig sabihin, if you will notice dun sa red, as it increases the pathogens, yung virus, nag-i-increase siya, lumalabas din, it also appeared yung mga manifestations. That's why if it appeared on the peak level, if the patient undergone the treatment, it is expected that there will be period of decline. If we say period of decline, the severity will be from severe, from critical, it will be moderate, then it will be mild. Yan. So as it goes with the period of decline, the manifestations are decreasing na. Until on the full recovery and the person goes back to its normal functioning, that is the period of convalescence. And thus, that is definitely associated with the number of pathogens. If the person attended medical attention of treatment, expect that the pathogens also will decrease. Manifestations will also decrease until the patient or the client becomes or experience full recovery on the period of convalescence. So this is the one way for us to know when it comes to the pathophysiology the importance of the periods of disease. So we will proceed to specific explanation one by one. Okay. If we say incubation period, the incubation period occurs in acute diseases. What do you mean by acute diseases? Acute diseases wherein you have been exposed to a situation uh, wherein the person is exposed to a situation of risk factors, if it is communicable or not. Even though if it is communicable, most kasi ng na-identify natin in these periods of disease are communicable kasi pathogens are the ones had been identified in the development of the disease, such as the causative agents. So now, this usually occurs in acute disease starting from the initial entry of the pathogen into the host. Host is referring to the patient or the client. So let's have the situation of the COVID-19. Na you have been exposed to a person who is confirmed with COVID-19. And obviously, that person is a carrier of SARS-CoV-2 virus. So the greater chances that the virus may have the initial entry to your upper respiratory tract. Even though it's just only an exposure, but you will mention to me, sir, it's just only I don't have any symptoms at all for now. I am asymptomatic. Pero you need to be isolated. You need to be quarantined for 14 days. But for now, I think for vaccinated, it's only 7 days for vaccinated. For 1 week na lang instead of 2 weeks. But the principle behind that, you will still be under observation. That's why the acceptable incubation period is different from unvaccinated, na you will be observed for almost 14 to 21 days, and from the vaccinated individual who have been exposed to a positive and confirmed COVID-19 infection for 7 days. So the principle is you still need to be observed for any signs and symptoms. So the initial entry is incubation period. When we talk about the chances that the microorganism or the virus are already in your system, already entered your body. So the virus starts now to have initial damage and affect specifically your state of balance and physiologic processes. When these pathogens continues to multiply, then obviously more the general signs and symptoms comes out from kaya that's why the virus it started with obviously with it started usually with fever, because it's not only referring to infection. It usually starts if there is inflammation, kasi it's capable of inflaming inflaming, or it cause swelling of the airway passages So dun pa lang nag-lead na ng fever, then afterwards lalo na if there's already the virus is already the one that are being identified as the cause of causing the inflammation. So we have already two, inflammation, and we have already the infection. So fever comes out, coughing will be experienced, those are the initial signs. So in those situations, you are already on the prodromal period, where in general signs and symptoms of the illness appeared. Next po, when we talk about the period of illnesses, the more that the pathogens multiply, the severity of the disease is obvious and severe. So if already in the period of the illness, this could be the level of critical level rather, there is already difficulty of breathing. Kaya that's why pag binansion natin yan, okay, the person ma'am is experiencing difficulty of breathing, nandun na siya sa period of illness. Kasi sometimes the person did not experience the early signs pero bigla yung difficulty of breathing niya, and eventually from the patient history, the person had been exposed to COVID-19 infection. You may now conclude that the person is in the period of illness. Okay? Next po, Now, when the person is on the perspective of treatment, the person may have the number of pathogens or pathogen particles begins to decrease. Most of the infections, viral infections, may have yung natural way of having the decrease of the pathogens. Just like, for example, we have certain periods like for measles and chickenpox. These are not if you will notice, these are cases that may not require hospitalization, because there is certain period that once it reached the period of illness, it will automatically lead to period of decline. Pero unlike for COVID-19, even though it's viral, if the person may not undergo treatment and nag-reach siya sa period of illness rather, lalo pa yung tataas yung severity niya. At once it will reach the peak, pwedeng mag-lead yan up to that level. Hindi yan period of decline, but eventually may lead to death. So that's why we need to take into consideration that the person must reach the periods of decline, wherein it is very evident of decreased signs and symptoms, and this is an evidence of recovery. And once the patient reach to the period of convalescence, the patient generally return to the normal functions because of the situation. Like, for example, if the patient was hospitalized, so obviously his or her condition were well monitored and undergone treatment. If the patient completed antibiotics for 1 week as prescribed, then that may consider po period of convalescence. If there is no symptoms and signs, and kung clear po sa mga diagnostic exams, the period of convalescence is the time wherein if you are hospitalized, you will be cleared for discharge. Yun po. So that's an evidence that the person reached the period of convalescence. Just like, for example, let's have an example for periods of disease. Hydrophobia. Hydrophobia, rabies. Okay, rabies is brought about by a virus. Okay? Do you know po na ang incubation period of rabies of rabid virus is 10 days to 15 years. So ibig sabihin, yung incubation period mo, you need to be observed for 10 days. If there are signs and symptoms that may be observed sa iyo and may need medical attention. Kaya that's why, di ba po, once you will be bitten by dogs and they are not vaccinated, then you need to be subject for the vaccination. Kasi within the 10 days, once it will reach the brain, and that will lead to the death or mortality. But can you imagine that the hydrophobia or rabies may lead to up to 15 years? Because actually, this is depending on the following factors. Yung factors of incubation period may depend on the distance of the bite. The closer it is in the brain, the chances that the incubation period, yung period itself, may manifest yung early signs and symptoms. Yung extensiveness of bite, if the bite of the dog is relatively identified sa head, tapos it's definitely close to a blood vessel, ayun, so possibly the virus may travel as fast as expected. The species of the animal could be, if for example the animal is not vaccinated, the animal is unknown with the history of health, yan yung problem. At another is, sa number 4, it may depend on the richness of nerve supply. Kasi since the rabid virus may travel the nerve, and usually yan po ang nagkukos ng tinatawag nating lockjaw and spasm of the muscles. So can you imagine that the incubation period is 10 to 15 years? So very critical na. You will not mention, you will not say and have your conclusion na anyway, I will not have my anti-rabies for 15 for 15 years pa naman ito. No, because the 10 days is the minimum. So meaning this may travel So again, it may depend on the 4 areas. So if it appear na po, for example, you are bitten by the dog, then chances it already have fever, anorexia, malay or weakness, sore throat, copious salivation, lacrimation, perspiration, hyperexcitability, you are already in the prodromal period. So these are the signs and symptoms that in the prodromal period, the rabies already penetrated your system. Okay? Now, if for example, the person may have short term of fever and suddenly you have checked that the person is already leaded to period of illness. If the person leaded to period of illness, that is the time that the person is already unconscious. The person may have loss of control with urinary and bowel control. The person will be paralyzed. The person will have the difficulty or irregular breathing pattern, then may lead to death. Question, sir. Why is it that there is no period of decline and period of convalescence? Actually, class, sa incubation period pa lang, you need to manage it within the 10 days so that to prevent prodromal and period of illness. And let's face it, the rabies has still no treatment once it reached the nervous system. So, in this situation, kaya pag sa period of illness po, ibig sabihin, sa period of decline, pag nag-period of illness na yan, yon medyo critical na yan. Critical that the extent of the damage to the brain and the nerves are extensive and chances that may lead to death. Usually yan, magli-lead yan sa respiratory arrest or cardiac arrest. So you have seen the flow na it's very important for us to be aware of incubation period, and once it appears po yung prodromal period, we need to be alert. Pag nag-prodromal period na yan, kailangan preventive na tayo. You need to seek medical attention. Pero pag nag-period of illness, ayan, these are the situations that they should be isolated, and chances kasi na very critical that the person may lead to death. Another example, periods of disease natin, pneumonia. Okay. Ang pneumonia treatable. Okay, usually pag mga diseases na hindi treatable, it only ended up with period of illness. Kaya if you will notice, they may not appear in the period of decline and convalescence. But pneumonia can be treated. So the incubation period of pneumonia is 1 to 3 days only. Can you imagine that? 1 to 3 days only. You need to observe yourselves for 1 to 3 days. So within the 1 to 2 to 3 days that you do not have symptoms naman, ibig sabihin, you are not reaching prodromal period. Clear ka during the incubation period. Because that's the time wherein within the 3 days na posibleng pag nag-lead ka sa prodromal, ayun, chances, ang ipe-prevent mo na yung period of illness. So that's why for the prodromal period, within the 3 days na yan, nag-appear po yung chills, continuous increase in the body temperature, tapos there's already chest pain and coughing. Yan, continuous coughing, nasa prodromal ka. Now, if for example that the person is spitting sputum na rusty ang color or such like prune juice, yung parang prune juice is parang almost, di ba, grape like color, pero yung prune kasi is mas darker. Pag color na yun na yung sputum niya, then you think na pathognomonic siya. Pag if you say pathognomonic, that is identical to pneumonia. Nasa period of illness na siya. So in this orientation, it will give us the idea kung ang person is mild, moderate, or critical. Kasi di ba from the COVID-19, if the person is asymptomatic, okay, even you're asymptomatic, you need to be observed for 7 days even though you're vaccinated. Pag within the 7 days, nag-appear yung manifestations, nag-fever ka, isa lang sa mga signs, identified ka na sa prodromal. Kaya that's why, di ba, pag if there are signs or symptoms that appeared, you are already mild, classified as mild. Pero you are advised to have home care management pa lang or home isolation. Pero pag nag-difficulty of breathing ka na, ayun na. You are on the period of illnesses and it may need hospitalization. So you'll see the flow. of when is the time that you must be having your mindset of when is the time that it may need emergency and immediate response. So dito sa pneumonia, severe condition na pala yon pag nag-spit na ng sputum na rusty color or kulay kalawang in colloquial. So but this could be treated. If the person undergone pharmacological regimen or treatment regimen or had been hospitalized when reached to period of illnesses, so it is expected that the period of decline may be identical. It shows that from the prodromal period and the period of illnesses, if these signs are decreasing, that is an evidence of period of decline. And once, for example, period of convalescence, sa period of convalescence, we could conclude that if there are no signs and symptoms that were identified in prodromal and period of illness, and diagnostic examinations will consider that you are clear with your X-ray, so that's the time that you will be on the period of convalescence or on full recovery. So I think that was the last slide on the periods of disease. So again, as to have the synthesis of our discussion, the synthesis of the discussion is related on the periods of diseases. And what are the periods of diseases? Incubation period is referring to the initial entry of pathogens. For prodromal period, there are general signs and symptoms appeared. Period of illnesses wherein severe manifestations are already identified. The period of decline is wherein if we have identified that there is a decreasing and improvement of health condition, decreasing of the signs and symptoms identified. And period of convalescence is the person is free from the pathogens as evidenced by diagnostic examination, clearance, and completion of treatment regimen. Are there any questions? So hoping my discussion for this afternoon or for this evening are clear to all of you. So probably you may turn on your cameras as we end up our discussion this early since we have finished the topics. You may turn on your cameras for final checking.